Hello everybody, welcome back to my channel. I've been on a little hiatus for a couple weeks, but it's ending now, so I'm gonna have a lot of new content coming out. But this video I want to start with giving nursing students some tips about just dealing with nursing school, the things that I wish I had known before starting nursing school and things like that. So these are basically do's and don'ts for nursing school. So my number one do not is do not get into the nursing profession for the wrong reasons. So if you're really thinking more of, I'm going to make a lot of money if I become a nurse, the schooling isn't that long and I can make good money, it's a stable career, I can move all over the country and still have a job. Yes, all those are true. However, you don't want that to be your primary motivation for getting into nursing, because nursing deals with helping patients. Like, it is the most people-oriented job out there, probably. So you don't want to be that nurse with the stank face who doesn't want to be there, who hates their job, who's just there for a paycheck. Nurses do a lot of work, and we really do make up for every single dollar that we make. We really do. So if you just want to get it for the money, you're going to be miserable, because it's good money, but it's good money if you actually love nursing. If you hate nursing, the money is not going to be worth it. You just have to genuinely like to help people. Like, dig deep down, is that something that you feel like you want to do? You want to help people. Whatever circumstance they're in, you just are the type of person that likes to help people. And if you're one of those people, then you're probably in nursing for the right reasons. Another do not is, do not buy all of your books for nursing school. Rent them. Rent. Because some people like to put it in your head that you should buy it because even after nursing school you're still going to use these books. But for the most part, that's not really true. So whenever you study for NCLEX, you're not going to be using your textbooks from class. You're going to be reviewing a review book from Kaplan, UWorld, whatever brand you decide to use. You're not going to be looking back at your textbooks. So you really should just rent them in the first place so that you're not spending all this extra money on books that are just going to pile up and eventually someday get thrown away. So just don't do it. In the real world, when you're a nurse and you have a question about something, you ask people around you, you Google it, you use medical apps. That is what is going to help you in the real world. You're not going to be on the unit and, I don't know what this medication is for. Let me go bring out my pharmacology textbook. Like, no, you're not going to do that. So don't buy your textbooks, rent them. So do buy your review books sooner rather than later. And I say that because those are going to be really helpful during your nursing program, studying for tests. So I use my Saunders Comprehensive Review Guide in order to study for some of my exams in nursing school. So I would get through the content in the PowerPoints, the content in the book if I bought the book. And like, once I felt pretty comfortable with the material, then I would look at my Saunders Comprehensive Review. So the review books for Kaplan really just break it down into like the nitty gritty. Like, they cut out all of those details that you do not need. It makes it simple for you to understand. And once you've already went through that material in the first place, it's like once you read that same topic in the Saunders review book or whatever review book you decide to get, if you don't understand it there, then you know you have a problem. You know that you need to do some more studying in order to understand this concept, because in those review books, it is in the simplest terms. So another thing I want to say is that if you do not know which specialty you want to go into, do not worry about that right now. That's what nursing school is for. It gives you all these experiences in different specialties, and it helps you to make that choice. You go through clinicals in pediatrics, labor and delivery, psych, med surg, community nursing. Sometimes you get opportunities like emergency room visits, operational room visits. So you have a lot of opportunities to learn what it's like to work in these different specialties while still in nursing school. And a good thing is, after nursing school, if you decide on one specialty, you can always switch afterwards. You're not stuck with it forever. You're just stuck with being a nurse forever. So another thing I want to mention is, do take the time in your clinicals to actually get to know your patients and take your time doing the assessments. Like, this is your time to actually learn how to do these things, because once you're in the real world, you just got to do it. So while you're still a student, take advantage of that. Ask as many questions as possible. Wait until you understand everything. I just started working as a nurse, a psych nurse, and I come into work sometimes and I have 10 patients. 10 patients to take care of. While in clinical, I would have like 1 or 2. So while you're in these clinicals, I would say use all of that free time to get to know your patients, to ask them questions about their medical background, and to ask them questions that you really don't even have to ask them. Like, just to get more comfortable with talking to people, your patients. For each clinical, there was a care plan that had to be filled out on that patient. And the only questions I really asked was those that would give me the answers I needed for the care plan. But whenever you're interviewing these patients, it leaves open a lot of room for you to just talk to them. And you will be surprised to find out how much information you get from just talking to them. But when you start talking to them about their life, they open up and they will tell you things about their medical background that they wouldn't have told you if you had just asked them that straight out. So that is very beneficial to use that time wisely, because once you are a real nurse, you will have like 10 patients and you do not have time to go listen to everybody's life story, okay? So get it while you can. Okay, so this is a tip that I wish I had known before starting nursing school. See, I went into nursing school thinking, yeah, they're going to teach me how to assess patients, but they're probably just going to have us like touching dummies and stuff like that. No, that's not how it was. So my class, there was a class of like 18 of us, and they basically just like partnered us up, and they made a game out of it even. It was like we would switch partners, go around the room doing different assessments on each other. We had to like strip down to sports bras and short shorts basically, and you do those assessments on your classmates before you do them on patients. That's something that never really crossed my mind, but it makes perfect sense. So along with that, nursing school can be very emotional, embarrassing. It can feel like too much to handle at times, a lot of times. But only the strongest make it through. I'm sure there's a lot of people who do not make it through nursing school. Another thing you need to think about is that your patient is not the only person that you're taking care of. You're taking care of your patient and their family. If their family happens to be in the room with them, then their family is your responsibility too. Their family may ask you to get this, or like ask you questions that you may not know the answer to, but it's still part of your job to find the answers or find out who can best help them. And sometimes, for me, I felt it could be a little awkward performing care on a patient and their family being in a room, just being so invested in everything I'm doing. But you just gotta think of it like, if it was the reverse situation, you would also be paying close attention to what this stranger is doing with your loved one. So another thing you should do is use your clinical instructors as references for jobs. So either if you're just starting nursing school, you need to be thinking about this from the start. Think about which professors, or you can use your instructors, and particularly the ones that have similarities in interest to whatever specialty you're going into. I use like 3 of my preceptors from psych clinicals as references for jobs. A lot of times in nursing school, you don't have time to work, and you're going to need those references, whether it's from a job or whether it's from a preceptor. Now, working during the nursing program, do's and don'ts. It really depends. See, I did an accelerated program, so I got my bachelor's in nursing in 12 months. It was very, very intense. I decided not to work at all the whole time, so I didn't work at all. But before I started the program, I already had 3 years of experience working as a home health aide with traumatic brain injury patients. So I got the experience that I needed. Everybody likes to publicize that there is this nursing shortage, and that's why we need so many nurses. There's actually a lot of new graduate nurses. The shortage is of experienced nurses. So there is a shortage of experienced nurses. Yes, there is. Do whatever you can do to stand apart from the other candidates. Now, working while you're in nursing school or before or after, whatever, that's going to help. Being a nursing assistant, doing anything medical field related, that's going to help your resume. That's going to help show that you have some experience. You definitely want to get a job. I would recommend it, because looking for a job as a new graduate nurse, it was a lot easier since I had that experience in home health. But if I didn't have any experience in anything, I think it would have been a lot harder for me. I would recommend that as a nurse, as a nursing student, you try to be organized. Now, some people are just organized, but some people are the complete opposite. It is hard to be a nurse and not be organized. Nursing requires a lot of multitasking. It requires delegating certain tasks to other people. And if you're not organized, you don't find some type of way to organize everything you need to do within that day, within that clinical, then you're going to forget things. So I know when I was in clinical, I made like a checklist. I made a Word document and basically made a list of all of those things on a computer that I need to check. And then I printed that out and brought that with me to clinicals. Then I would just check it on there, and it was just a lot simpler for me. I don't know if that makes sense. Some of the things were like check lung sounds, head to toe assessment, and all that encompasses. Ask them social questions, ask them psych questions, things like that. I had a whole list, a checklist, and I would bring it to every single clinical, and it helped me a lot. I would even give it to some of my other classmates because it helped them. So being organized is very important in this field, and not being organized don't want to be dramatic, but it can lead to patient death, honestly. It really could. So you just want to be on top of your stuff, because you don't want to not be giving enough care to one of your patients just because you're not an organized person. Okay, so my last tip for nursing school, this one is related to my previous video about passing out at clinical. But I just wanted to say that you should eat something before clinical, stay hydrated, bring water with you, drink it throughout the day because you don't have a lot of time. I'm a procrastinator, okay? So I will wake up late and I'm like, I don't need breakfast, or I'll just drink a couple apple juice and go. But like, that's not enough. You need some carbs, you need some protein, you need a lot more. And clinical is really going to test you. It's going to test your coping mechanisms. It's going to test how well you are at handling stress. So you want to do that while you are completely energized and you have all the fuel you need. Fuel being food and drink. So please don't pass out at clinical like I did, because it is embarrassing. And if you want to hear about that, go watch my video. Yeah, so that's all I have for you guys. Stay tuned for more videos, and if you haven't already, please subscribe below.